The eye conditions that are more common in diabetes are diabetic retinopathy, which is a condition that affects small blood vessels of the eye, cataract, a condition affecting the lens, and glaucoma, a condition affecting the nerve at the back of the eye that can affect peripheral vision. The conditions that are more common in older people are cataract, glaucoma, and a condition called macular degeneration, in which you get some changes in the macular area at the back of the eye, that is the area where you get clear central vision and colour vision. The first two photographs that I have show the effects of cataract surgery on an eye. In the first photograph on the left, you'll see a pacification in the lens that has spread to the centre and affected the visual axis. The photograph on the right shows an eye that has had a clear plastic implant inserted, and with the pupil dilated you can see the edge of the implant, but once the pupil is allowed to constrict again, the iris will form round in front of the clear lens and look quite normal. The effect of a cataract is a combination of blurriness and scattering of light and an alteration of colour. Once a clear plastic implant is inserted at a cataract operation, patients often express the view afterwards that they can suddenly see colours again that they have not been able to see for years. The photograph on the left shows how a cataract lens has become really quite brown and acts as a brown filter, so not only is the image blurred, but the image is also very brown, which is the effect of a cataract. The photograph on the right shows how light is scattered as it goes through the eye, and so patients complain of a lot of glare, but also if they're trying to drive, car headlights really produce a lot of glare around the edge of them and makes it very much more difficult for them to drive at night. The next three photographs that I'm showing demonstrate a different condition or different conditions in the eye that affect the macular area. The macular area is where you have a concentration of cones in the centre of the retina in which you see the clarity of central vision and you see colour vision. So if the macula starts to be affected by a disease affecting the eye, not only do you lose a certain amount of clarity near the centre, but also the vision can become distorted so that straight lines become kinked and patches of vision can be missing near the centre. The three photographs show a normal photograph of a Cirencester street on the top left, moving to an early stage where there's a bit of blurring near the centre and a bit of kinking of straight lines, and then this increases so that when the macula is more significantly affected or more severely affected, then the peripheral part of vision of the eye will never have the clarity that the central vision had in the first place. The two conditions that affect the macula are diabetic maculopathy or macular degeneration. And in macular degeneration, you can get a combination of wear and tear build-up of material over a number of years, and this is called drusen, or you can get degeneration of the tissue in that area, and occasionally you get a blood vessel coming through from a deeper layer of the retina which leaks and produces fluid in the area, and that's called wet macular degeneration, and the rate of change in wet macular degeneration is over a few weeks rather than a few years, which happens much more slowly in a dry form of macular degeneration. I took this photograph to show the effect of glaucoma. In glaucoma, there is a build-up of pressure in the eye. The reason for this is that there is a constant flow of fluid within the eye that is produced in the front part of the eye, and a drainage valve in the front part of the eye. And if the drainage valve is not working very well, the pressure in the eye builds up and it affects the nerve at the optic nerve head at the back of the eye. When the pressure builds up, the nerves that are most affected are the ones that affect peripheral vision. And so a small loss of peripheral vision can come on without people noticing it, and then as it progressively develops and the patient starts to notice it, then there's often quite a loss of peripheral vision before the presentation on visual symptoms. The photograph shows how an eye might see with peripheral visual loss. In order to maintain visual health of one's eyes, it's important to detect any eye condition at the very early stages, particularly conditions such as diabetic retinopathy and glaucoma, where it's very much easier to treat a patient's eyes before any significant deterioration has occurred. In order to do that, one needs to attend for diabetic retinopathy screening. All people in England with diabetes are invited for a photographic screening once a year, and it varies in different areas where they're invited. Sometimes they're invited to their local GP surgery, sometimes to their local opticians, but the screening is by photographs of the back of the eye. And it's also important that people attend for an eye test every 2 years at their opticians to detect cataract, glaucoma, and the early stages of macular degeneration. It's also important that when people develop symptoms, they know what to do. We have had people who've lost vision in an eye and not presented for several days afterwards. And clearly it's important that if people have significant visual symptoms, that they present to eye departments at an appropriate stage where it's possible to do something to help their sight.